Hello, my name is Karen and I am an occupational therapy student at Kaiser University's MSOT Bridge program. As part of my virtual fieldwork experience, I am creating weekly YouTube videos discussing various topics. This week, we interviewed a pediatric occupational therapist to discuss what challenges they faced, what they enjoy most about working with a pediatric population, and any recommendations they had for us as students entering our Level 2 fieldwork. I interviewed a dear friend of mine, Tara, who is an occupational therapist at a private hippotherapy clinic in a neighboring town near us. She actually just started this past summer working there. I met Tara through work at the geriatric hospital, but she has since switched to doing part-time at each facility. She says that she was most surprised to find out how much she actually enjoys working with kids. It's the complete opposite side of the spectrum of where she usually works with me with the geriatric population. So that was something that was most surprising to her, was to find out that she actually enjoys working with children, especially the younger children. She said that her favorite are working with children who are like ages 3 to about 7. She loves that they keep her on her toes and they come up with the craziest stories and they're brutally honest. When I asked her what the most challenging case she's had so far, she said that they had one child who was a teenager, and he was a large male who was a lower level functioning teenager with autism, and he had several behavioral issues. She said that coming into the session, he was actually pretty agitated and had been known to be aggressive. He was larger than her and the other staff members present, so she was a little intimidated about working with him and wasn't sure how it was going to go. She said that trying to get him to agree to approach the horses during the session was the hardest part, but actually once he was with the horse and petting the horse and they were able to get him onto the horse, he calmed down significantly, and she said to get to see that change in his demeanor was just amazing. When I asked her what was one myth you hear all the time about pediatrics that you wish you could debunk, she said not so much in the professional field, but for people with the general public, when they hear that you work with kids, they think you just play all day, because that's all you do is you work on games with the children, you play with them, and all you do is have fun. It's not really work. And she said, although it is very fun to work with the kids, there is a lot of effort that goes into planning the treatment sessions. You have to know your developmental milestones, know what outcomes are expected, also such as working with children who are larger or have behavioral issues. It's not just playing games with babies all the time. Working with kids goes from infants all the way to technically the age of 21. So that's a long time period to cover. And unlike adults, where you typically, once you're at a certain age, you don't change much developmentally. If I treat a 30-year-old versus a 50-year-old, I'm going to have roughly the same. With kids, 0 to 21, every year, even sometimes months within the year, are extremely different. So she said there's a lot more work that goes into working with kids than the general public realizes. As a student, what surprised me the most about hearing what she had to say about pediatrics, I was surprised just knowing her personality, hearing how much she enjoyed working with kids, because I knew how happy she was working at the adult hospital with me. So to hear how excited she was to actually get to work with her children was very surprising. I was also surprised to hear just the different ways that they incorporate the animals into their therapy session and how they are blending occupational therapy together with using the horses. So for instance, working with having the child sit on the horse and participate in reaching activities to reach for with rings to put poles on while the horse walks by the pole. And actually sitting on a horse while they're walking, that pelvis motion you're getting can help facilitate the same movement you have with ambulation. So riding a horse is actually viewed as a preparatory activity as far as preparing your body to be able to perform that walking motion. What do I find most challenging about pediatrics? I think after speaking with Tara and her whole debunking the myth thing, it just kind of reiterated the fact that I am concerned about knowing all the developmental milestones and knowing at what age a child should be performing this certain task, or at what age you have to look at their fine motor skills, their gross motor skills, their self-care skills, where they are in play. Are they in social play, exploratory play? And then also cognition, where they are developmentally with that too. There's just so much with pediatrics. And I think the most challenging thing for me is going to be able to memorize all of that, but also just getting it straight in my head. So I'm really hoping that once I join my level 2 fieldwork site, that I pick up on it quickly. And as far as what was her biggest piece of advice for me and my cohort before we go on to our level 2 fieldwork, she said her biggest piece of advice is just to have confidence, just to know that you've already been practicing as a CODA and you already have this skill set, and now you have your CODA experience plus your master's program experience. So just combining that and entering into the fieldwork knowing like you have a right to be here and you are also almost finished. So I think that was really good advice, because sometimes I can be a little more shy and timid and withdrawn. So just to realize like, I've got this, it's going to be okay. She said her second piece of advice was to also not to be afraid to ask questions, because although we should be confident as students moving forward and confident in ourselves and our knowledge, this is also a fieldwork experience. It's for a student. You're not really out on the job in the real world. So this is a continued learning educational opportunity. So making sure to ask my CI questions when I have them, not random questions, but not being afraid to ask important questions so that I can continue with my educational journey and continue preparing for my boards. Thank you so much for joining me this week. It was very fun to actually get to hear about what it's going to be like working with pediatrics from a fellow coworker of mine, and I really enjoyed learning from her, and it's making me even more excited for my level 2 fieldwork. I will see you next week for the final video for level 1 fieldwork.